Moving ahead with the next session, Dr. R.M. Shah Oration. I would like to invite Dr. Mayur Patel sir and Dr. Mahadev Desai sir as a chairperson for this session. We welcome you, sir. Before we start, I would like to talk or address about what is RM Shah Oration with pleasure to everyone. Only a very enlightened and great personalities can give us a final and authoritative knowledge or wisdom that leaves no questions, and not all of us have that privilege to listen to them or meet them. It is therefore a very special opportunity for us to honor a person who has attained a prestigious acclaim through his achievements and reached this lofty position. We are honored to invite Dr. Mayur Patel sir and Dr. Mahadev Desai sir to deliver the RM Shah oration to Dr. A.G. Unnikrishnan sir. Over to you, sir.
It is my pleasure to introduce Dr. A.G. Unnikrishnan. He is a CEO and Chief of Endocrinology at the Chelaram Diabetes Institute, Pune. He heads clinical care, research, education, and also oversees a philanthropic rural diabetes care program. He has more than 190 PubMed index publications. He has received the Jacob Memorial Prize for the best patient care. He has received the Subhas Mukherjee Oration Award of the Endocrine Society of India and Srivastava Award of the RSSDI. He has received the Fellowship Award of the RSSDI and Dr. Sam G.P. Moses Oration Award by Diabetes Association of India and Diabetes Excellence Award at Digital Summit Diabetes Summit. Recently, he delivered the Madhukumb Oration at the Annual Diabetes Association meeting at Nasik in Maharashtra. With this brief introduction, on behalf of our organizing committee and on behalf of the award selection committee, it is my pleasure to hand over this oration award to Dr. A.G. Unnikrishnan.
Thank you, sir.
Dr. R.M. Shah was HOD, the head of the Department of Diabetes and Endocrine Unit, VS Hospital. He was pioneer in diabetes care in the state of Gujarat, and he was my teacher. With this brief introduction, I'll hand over mic to Dr. A.G. Krishnan to deliver his oration award.
First of all, let me thank Dr. Mayur Patel and Dr. Yash Patel for this invitation and for honoring me with the prestigious Dr. R.M. Shah oration. The SwasthyaCON meetings are excellent meetings, well organized with excellent scientific content, and I'm truly honored to be with all of you. My title of my oration is Journey of a Diabetes Institute, and I'll talk about me as an individual and the institute and about twin journeys. So let me begin by talking about certain inspirations. Everyone has something or someone with them to inspire them. And one of the important inspirations for me has been my grandmother, who was skilled in writing and speaking English, and she used to write all my speeches when I was a child in school. And I owe a lot of my success to my grandmother. Along the course of my presentation, this oration, I'm going to not just talk about what I did correctly or what I did wrong, but also what I learned. And that is what I will be sharing with you. We often don't know what we like till we actually find that out. And I always thought that I never used to like biology in childhood. When I was an adult, I used to think, oh, I never liked biology when I was a child. I grew into it later. But when I saw this little picture of me as a child reading a biology book, I suddenly realized that sometimes we think we are like this or we are like that, But when you look at your childhood pictures, you remember that, yes, you are always destined to be somebody and somebody else. And in this picture, when I see me reading biology, I thought of myself as a maths and English person. But when I look at this picture, I realize that I was always destined to be biology and maybe do medicine. Many people talk about planning aspects of their life, but sometimes serendipity is a very good teacher. Sometimes suddenly something comes your way and you just take it. This picture is of the Dodd Library at the Christian Medical College, Vellore, where I did my MD. And I was just sitting and studying here one day in the library when I was met by Professor Simon, who was a professor in endocrinology, and he told me, Uni, what are you planning to do? I said, I don't know. Tomorrow is my MD exam. So he said, why don't you join endocrinology? I said, I was thinking of joining nephrology, but tell me why I should join endocrinology. He said, endocrinology is an upcoming science. There are very few endocrinologists. You will be able to take care of, you will be uniquely able to take care of people with endocrine disorders because there is a shortage of endocrinologists in India. So I said, okay, let me first finish my MD exam and then I will decide. But I took his words very seriously and I joined as a lecturer in endocrinology at the Christian Medical College, Vellore, the endocrine department, and went on later to do my DM in endocrinology also. I'm always asked, Dr. Unni, where are you from? आप तो बहुत अच्छा हिंदी बोल लेते हैं, आप कहाँ से हैं? So I've studied in different parts of India, and whenever I'm asked the question where I'm from, I really don't know because I feel India is a country, and today we know that in the midst of life as it is that we know today, we know that the world itself is a family. Yes, we might or might not find people that we know everywhere, but there is a person like everyone everywhere. Just to give you an example, you might think there's no Dr. Unnikrishnan in Ahmedabad. There may not be, but there will be somebody like me there. And there'll be somebody you know everywhere you go because people are the same. So we are just in a little world, a little country, a little state, a little city, but we are actually part of a whole universe. So whenever I'm asked this question, where are you from? I really don't know because I've always tried to think that I could be from anywhere in the world or from the universe for that matter. And I've never tried to restrict myself to one part of the globe. Indeed, if you look at it, I'm working in Pune. I was born in Kerala, brought up in North India. I studied my MD in Vellore, MBBS I did from Kerala, and my DM from the Banaras Hindu University. My wife is from Karnataka. So you could say that I belong to the whole of India as well. What I also found is that I've been very privileged to study in institutions which have taught uninhibitedly, and I have learned from everybody as a teacher. So as I said, I worked at the Banaras Hindu University as a DM resident. I did my DM there. Then I worked as an assistant professor, associate professor, and a full professor in Amrita Institute. And I have learned a lot from all my teachers there. For that, I'm very, very grateful. I also have several limitations, and I know that I have limitations. So it is said that everybody has limitations, but if you do have limitations, you should know that you have limitations and you should know your limitations. Well, I'm going to talk about my learnings to all of you today. And one of it is that happiness is the beginning of change. What do I mean by that? What I mean is that whenever you are very settled, whenever you are very happy, you are probably not in a good place because you are thinking of moving ahead because you can't be too comfortable. Once you're too comfortable. So when I was a professor with DM students, I was in a very comfortable place, but I was too comfortable. I was enjoying life. I had a lot of people around me and I was relaxing. Then I realized that I needed a new challenge. And as I say, being settled or being happy or being contented is the beginning of change because then a fire grows within you. And that is how I moved to Pune, to the Chalaram Hospital, Diabetes Care and Multispeciality, which is, of course, under the Chalaram Diabetes Institute. And we went on to do, we are doing quite well as a hospital. But friends, I am getting ahead of myself. And let me retrace my steps a little bit. And let me talk to you about how I moved to Pune and what the Chalaram Diabetes Institute is all about. Chalaram Diabetes Institute was founded by our chairman, Mr. Chalaram, and the Chalaram Foundation is part of the Chalaram group, which is almost 100-year-old group and has got educational institutions. The KC College is very well known in Mumbai, supports schools in South India, has a school for Center for Disabled Children, has been doing a lot of charity work. And this Chalaram Diabetes Institute is the first healthcare initiative by the Chalaram Foundation. And I'm very grateful because the Chalaram Foundation's founder, the chairman, Mr. Lal L. Chalaram, is personally involved at every stage. And when the chairman of the institute or the owner of the institute has a passion towards diabetes care, and the management also thinks similarly, wonders happen, as I'll tell you. But let me also share some difficulties, because moving from Cochin, as I said, I was a professor in the Amrita Institute in Cochin, where I had my Kerala friends and the coconut trees and the temples. So moving from Cochin to Pune was a most difficult period of my life, because though the physical part of moving was easily handled, the relocation was easily handled, I had a lot of emotional issues while moving from one city to the other, because I had all my friends, my relatives in Cochin, and I really loved Kerala with the coconut trees and temples. And indeed, a lot of my patients were very upset when I left. Indeed, I could remember many of them cried when I told them that I'm leaving Cochin, I'm going to Pune. So it was a very difficult time of my life. But whenever every patient who came and met me, I would take that patient to my colleague and say that, okay, I'm leaving, but this patient would be taken care by my colleague, this person from now on. And I think that's very important, because when we as doctors, we of course change hospitals, may move cities, but at the same time, it is very important to have that loyalty to our patients. And even now, some of my patients from Cochin write to me asking for doubts, and I try to clear it as much as possible. But I look at with very great excitement to the city of Pune, which is actually a wonderful city. And I have been very, very welcome in the city of Pune. The entire medical fraternity has welcomed me. And one of my approaches has been, first, I had already said that, when people ask me, where are you from? I'm from the entire India. I don't feel that I'm from a single city or a single town, but I feel that I'm an Indian first. The other thing which I learned is that we have to respect people. And I've always tried to respect people around me. And only if we give respect, we will get respect. And the second thing is to learn about, if you're moving to a new place, to learn about that place, the people, and try to be like them as much as possible, because that's very important in life, because you learn a lot when you meet people. So these are two of my pictures. The first one on your left is in Brisbane. Just to illustrate that I'm looking so odd, I'm wearing a shoe and a blazer and a tie. But remember, I'm standing in front of a really beautiful swimming area, and I'm not wearing any swimming dresses. I'm wearing a shoe and shirt. On the other hand, on your right, I'm standing in the pond of a famous Guruvayur temple in Kerala, which I visited before moving to Pune, and I'm dressed appropriately. So it is important to be according to the place that you are in. And to do that, one of the first things I did when I reached Pune was to participate in the Chalaram Diabetes Institute's newly started outreach program. So I did go to rural parts of Pune. I spent time talking with people, and I realized that all human beings are similar. People are just the same everywhere. They have the same moments of happiness, same moments of sorrow, same moments of amazements, and the emotions and the people are just the same everywhere. And I spent a lot of time learning from people, because when I moved to Pune, initially I had a lot of time and I learned a lot from the people, and they have given me so much affection in return that I'm quite grateful. This is a Chalaram Diabetes Institute's outreach program, and you can see the mobile diabetes clinic. I'll talk about that a little bit. And we have inside that a diabetes clinic with ankle brachial Doppler, biotissuometer, fundoscope, and we also put a TV to spread awareness about diabetes while people are waiting. Many years ago, when we started our patient care facility, we started with a simple outpatient setup. So a simple outpatient setup, but with an ophthalmologist, with a fundus camera, with a very good nutrition facility, because we thought that was important. And we also trained our doctors. This is not me, this is one of my colleagues, Dr. Manish, who's still working with us even now. So we train our doctors and we tell them that you have to explain about diabetes care to the patients, because so our doctors prepare PowerPoint presentations and explain about, for example, why diabetes should be treated. So I think if you ask that question to your patients, you'll be very surprised. Sometimes you'll just ask your patients, you can just ask your patients and see, why should diabetes be treated? Many people will tell you it damages organs. Then you ask which organs, they'll say liver, brain. So you really have to, the first thing that a newly diagnosed diabetes patient should be told is why we should treat diabetes, and the complications like neuropathy, nephropathy, retinopathy, and coronary artery disease, peripheral vascular disease. And we also set up a small laboratory facility for patient care. And as we gradually expanded, what we did is that we decided to do a home collection service for people within 10 kilometers to 15 kilometers of that area. Many people found it difficult to come fasting, especially Pune has a lot of people from the technology sector, IT sector, and they find it difficult to come fasting. And therefore, sometimes we take the blood one day earlier fasting, so that by the time the patient arrives, lots of the reports are there in the computer. So this is something we started almost 10 years ago. After our outpatient facility was successful, we started an inpatient facility. Because why did we start an inpatient facility? One of the reasons is that diabetes affects the kidney, the eyes, the feet, the heart, and especially renal problems, cardiovascular problems, foot problems often require admission as infections also. So we wanted that flexibility to hospitalize patients when needed. And the second reason was that people from the surrounding areas, as our hospital grew, the people around us, also that area had a lot of, the population increased, and people started saying that we need a hospital to come to for our diabetes care. So we started our diabetes hospital full-fledged, and you can see this is a picture of the inauguration. And we, of course, started the entire diabetes care experience under one roof. This is you can see on your left, the team of doctors at our institute. So we had, of course, endocrinology. I was there. We had diabetology, cardiology. We had a podiatry service, vitreoretinal service, nutrition services. We had a cath lab because many people with diabetes had needed lower limb work, angioplasty work, and also coronary angioplasties. And also we had a dialysis center to take care of kidney-related, the dialysis aspect of diabetic nephropathy, theaters for diabetic foot bariatric surgery, and of course, even laparoscopic surgeries in people with diabetes. We also had a operation theater for cataract surgeries and other ophthalmic surgeries. If you see the reception of a picture, and all of you are setting a diabetes care center, you can just look at the reception. We thought that it's important that the patient feels comfortable. So we looked at very warm and friendly lighting, and you'll see little pictures on the wall. What we did is we set up pictures to show why diabetes should be treated. So we talked about retinopathy in that. We've shown the kidney there. We show the feet. We show the fatty liver disease. We show the heart. So we show pictures while patients are waiting, but we designed the pictures in a very aesthetic manner, because at the end of it, the patient care experience has to be beautiful, and we try for that all the time. We thought that it is time to have an education department in our hospital, and therefore we started an education department, and we started again very small. with several international faculties coming to speak. And in those days, our hospital was a very small hospital. And when these international stars came to our hospital, our staff felt very, very motivated. And that's very important, to motivate them, to make them feel that they are larger, they are part of a very larger mission to help humanity. And that was indeed our aim. And that is very important, that bringing top-class doctors to your hospital from all over the world to encourage the staff in the early stages of a hospital. We found that it was fantastic. So we had inspirational lectures from Dr. Basus, for example, from the Mayo Clinic. Now they are in the University of Virginia. Dr. Sri Nair, of course, the very famous Dr. Mashelkar, who's a legend, has also participated in many of our programs. We also thought that it's not enough to just make sure that the patients are aware or the rural outreach people are aware. We wanted to also reach the urban elite, and we thought that setting up a magazine in diabetes is very important. So we are now almost in our 10th year of this magazine, which is running very successfully, called Diabetes Health. We have an online version for the Android platform and iPad platform. And this magazine is not about our hospital. We call people from across the country to contribute articles. New ideas are presented, new thoughts are presented. And we thought it's important to start a diabetes education program in the magazine. We also thought that sitting in a clinic and seeing patients is what everybody does. Randomized control trials tell us to control diabetes using focused therapies. But remember, the responsibility of following diet, exercise, monitoring, and taking medication is on the patient. So therefore, I feel that even if we are diabetologists or endocrinologists, sitting in the clinic and seeing patient is not enough. We have to be social diabetologists or social endocrinologists. You can see the community endocrinologists. We have to step out and interact with people around us. And that not only gives visibility to the institution, we are also doing a very noble task of spreading the word of diabetes awareness. So we have done so many events for diabetes management, including quizzes for school children, walks, marathons, runs, cooking competitions. So this is something very, very important. But the most important, and maybe many of you would have attended, one of the most significant initiatives in education has been our International Diabetes Summit. When we began the International Diabetes Summit, I never realized how successful it would be. But we focused on bringing high-quality international speakers to India to promote new ideas and new thoughts among our doctors. And I always thought that we should put only practice-changing topics. And that is how I think for all of you out there who are starting diabetes centers, having a conference is very, very important. As you know, this wonderful conference, SwasthyaCON, is a perfect example of that. So this International Diabetes Summit, and also along with the International Diabetes Summit, during the second or third summits, we introduced the Chalaram Foundation Diabetes Research Awards to be presented to the presenter of the best research paper. So I also never thought it would be so successful, but we got lots and lots of presentations from across the country, top institutes, the Indian Institute of Science, PGI Chandigarh, across the country, good institutes participated. CMC Vellore, so many good institutes participated. Excellent papers came out, the CSIR, all top institutes participated, and that we thought is important to foster, to nurture research in India. And that brings us to research. Research is all about research and searching for a higher truth. And therefore, we thought, many of our colleagues, so I always, whenever I get a chance, I speak to experts in the field, my own colleagues, diabetologists, endocrinologists, and they said, Dr. Unni, it's time to start doing research, both clinical research as well as academic research. And therefore, we have now started a small research facility where we have started doing clinical research and also academic research as well. But we are in a very urban city. The city of Pune is an urban city with IT personnel, lots of manufacturing, well-off urban people. But can we reach the rural poor? That was the focus of our outreach program. And this is the map of Pune. And our outreach program consisted of the hub and spoke model. So the hub is a large village, the spoke is a small village. So we trained Asha workers, rural health workers, to go to the smallest of the small villages and bring people for screening, at people at high risk for diabetes for screening, to the hub. So every time patients are brought to the hub, we make sure our mobile clinic also visits the hub. So once the mobile clinic visits the hub, the Asha workers, the community health workers, bring all the patients on that day. And when that visit to that hub is over, we change to another hub. So each hub has got lots of spokes. Just to give you an idea of the picture, this hub, as you can see, is a larger village, and this is a spoke, which is a smaller village. A mobile diabetes clinic goes from the hub to the spoke, and when it goes to the spoke, all the patients are brought by the Asha workers to the spoke, and there they are screened for diabetes, they are screened for diabetic complications, and the mobile clinic returns to the hub. When one hub and all the spokes are completed, the mobile clinic migrates to the next large village. So like that, using the hub and spoke model, we've completed all the villages in the area of Pune, and we published so many papers of our findings of diabetes care in the community, and also how community health worker intervention can help improve quality of life. You can find that in the internet, so I'm not going to talk about all those publications. If you just check on internet, you'll find all our papers. Indeed, our outreach program, entire protocol is available online. This is a picture of our mobile diabetes clinic, and this is a picture of our outreach team training Asha workers, and the Asha workers also training other Asha workers. And this mobile clinic has got a retinal camera for taking fundus photographs, an ankle Doppler and biothiometer for checking neuropathy, and Doppler is for peripheral vascular disease. And we have a registration counter, and a medical officer sees the patient. We have blood glucose checking. And this program has been very, very successful. Indeed, we published a paper where we showed that just the Asha workers going house to people's house and empowering them with information is enough to lower HbA1c and also improve quality of life. So this has been a program very close to our heart, and this is a completely non-commercial program. And these are not, we don't refer these patients to our institute. We ask them to go to the nearby government hospitals, and we often train the government medical doctors also. Before I come to the end of my talk, I just want to talk about certain new projects that we started. And when we talked to all the diabetologists of the country and the endocrinologists of various institutes in India, they said, Dr. Unni, now it is time to start something new, a research foundation perhaps, and also your own journal. And also, given the pandemic, it is important to start e-learning, because remote learning is now possible through e-learning. So therefore, we started the CDI Academy, or our e-learning platform. And I suggest everybody starting diabetes clinics should look at online education as a tool. So this is a course for diabetes educators. We have a course on preventive podiatry for healthcare professionals, including podiatry training. We have obesity course. We also had courses on gestational diabetes, lipidology. All these courses have been highly successful, and some of them have got accreditations from, for example, the obesity course is accredited by the World Obesity Federation. Scope points are given. There is a PHFI accreditation. We also, some of our courses also accredited to the Leicester Diabetes Center of the UK. And that brings us to our latest initiative, which is a Chalaram Diabetes Research Center. We thought that we cannot do everything. We have to collaborate. And if necessary, our Chalaram Foundation has to fund innovative research. So we decided to fund innovation grants for projects making a short-term or a long-term impact on treatment of diabetes. We've already funded some projects in the past. And with this Chalaram Diabetes Research Center, you can check the website in the details. We decided that we are not going to apply for grants. We are going to give grants to budding researchers, innovators who want to make a difference to diabetes. One of the important aspects are the development of newer glucose sensor technologies. Continuous glucose monitoring is an excellent tool, but very expensive. But continuous glucose monitor for India. So these are some of the projects we are interested in funding, and I encourage doctors who wish to do research to apply for funding and with good projects which can make an impact on treatment of diabetes. So we also have our own now journal, which is coming out in January, the Chronicle of Diabetes Research and Practice, which is a flagship journal of our institute. But the publications of the journal are not for our institute. They are submissions can come all over the country, and we are here to facilitate and to nurture research for the entire country, to become a model diabetes center for India, and to help researchers all over the country to nurture research. That has been our motto. Of course, our institute has got lots of awards and accomplishments and recognition. Indeed, our chairman, Mr. Chalaram, recently was awarded with India's highest honor for an overseas citizen, the Pravasi Bharatiya Samman Award for the clinical care from the Chalaram Diabetes Institute. And our hospital is also consistently ranked among the top 10 diabetes hospitals in India. So when I look at all the honors, you see, indeed, we have been consistently ranked in the top hospitals for diabetes care in India. But when I see that, I see recognition, but I also see accomplishment. Recognition is that people have recognized us, which is great. But accomplishment means we have done something, and that is what gives most happiness, accomplishment. And this is a picture of our team, our entire team taken during the International Diabetes Summit 2019 with our chairman. And I'd like to take this opportunity to thank each and every member of the Chalaram Diabetes Institute, which is like my extended family, and the members of the Chalaram family, and also the members of my own family who have been supportive to me as well. So it is, success is not of one person or a few people. Success is when the entire team works together, and we are a young team and we want to make an impact, a beneficial impact on diabetes care in India. Friends, once again, I've tried to take you on a little journey, and I thank Dr. Yash Patel and Dr. Mayur Patel for allowing me to take you on this journey. And with each step of the journey, I've tried to give little messages about what I learned from this journey. But one of the greatest messages has been the affection and the warmth that I receive from the doctors across country, and that is one of the main things that keeps inspiring me, and for that I'm eternally grateful. And I think all of us, we as doctors, need to remember that we have our family, we have our friends, and we have each other. And we as doctors, if we work together, we can harness the power of the internet, the power of collaborative research, and do wonders for helping people with diabetes across the country. Once again, thank you for conferring on me this honor of delivering the Dr. R.M. Shah Oration. And also special thanks to Dr. Mayur Patel and Dr. Yash Patel and the SwasthyaCON team, Dr. Sushil Patel and the SwasthyaCON team for choosing me for this oration. And it's an honor being here. Wishing you all a great day ahead.
So we would like to invite our scientific committee chairman, Dr. Mahadev Desai, who is co-chairing this session. So Dr. Mahadev Desai, sir, please. And it is a pleasure to hand over this award to Dr. Unni. We'll make sure that this reaches to you. Yeah.
First of all, Dr. Unnikrishnan, congratulations. And when we met for this conference, oration committee, it lasted less than 1 minute to choose the awardee. And we are sure that we have the right person. But we have chosen Dr. Unnikrishnan as an academician. We never knew sensitive, emotional Unnikrishnan that we'll shot today. And I think that made you very great. And all your work has been excellent. You have made our job difficult for the next year, whom to choose for the award. But anyway, done a wonderful job, and you deserve all the credit for all this. Thank you very much for accepting, and you have made our oration also a big one. Thank you.
Thank you, sir. Thank you, all of you. Honored to be here.
Thank you very much, all of you.
Yes, Dr.
Yes, you can express here. Yes. Yes, Dr. Unnikrishnan, you want to say something?
I just wanted to thank everybody, Dr. Yash Patel, Dr. Mayur Patel, Dr. Desai, Dr. Sushil Patel, and the team for the honor. I feel moved. I feel very honored. Thank you so much for the honor.
Thank you, sir.